Hello, today is Friday, May 15th. 61 days ago, we closed the facility to visitors and enacted our pandemic plan in response to the global threat from COVID-19. During those first few weeks, we were extremely busy as we prepared for an outbreak, as if it was destined to arrive. Happily, it has not. Since then, we have tested 40 residents. 38 were negative, and we have 2 outstanding results we anticipate will be negative due to existing health conditions. But, like always, if there's any sign of a symptom, we test. We've also tested 91 employees. Those were done proactively to ensure we weren't missing anyone who was asymptomatic for the virus. They have all returned negative. 2 employees were tested in the community and were positive. They were not on site and therefore not considered a case at St. Vincent's. Luckily, one has fully recovered and the other is still in isolation but improving. Although we have not experienced a positive result, our staffing has been challenging during the pandemic. Part of the pressure has been the result of our approach as to whether or not we allow an employee to work for us during this time. If they either live with someone who is connected to a facility with an outbreak, who works at a test facility, or who has been in contact with a positive case but not considered a close contact by public health. We're not required to restrict these employees, and it is a very low risk, but we decided early on that whenever we could, we would accept as little risk as possible. Whether this has contributed to keeping the virus out of St. Vincent's or not is not known, but we feel the financial cost and the reduction in the workplace are both worth the added protection. We will continue these practices as long as we can. As the weather warms, residents will spend more time outdoors. Unfortunately, we're not able to accommodate visits on the grounds, even with social distancing. Visitors are not allowed on the property without prior approval. We are reviewing how we can safely accept items dropped off for residents, including lighter summer clothes. It's likely we'll set an appointment to accept items, but we will provide the information once it's finalized. Until then, we continue to not accept items at the door. Lately, it seems as if there is a light at the end of this tunnel. Restrictions are slowly being lifted and the number of cases in the community are decreasing. Although those are great things, the public health directive remains in force, and Dr. Strang's message has been clear. They may lift restrictions in the province, but we must continue to protect the most vulnerable of our population. Our employees have been doing a great job of just that. We are now asking them to continue to maintain the vigilance they have at work and when off duty. For those who do not have a personal fabric mask, we have a supply at the front desk that was donated, and we'd like to ask you to take one home. Use it when you're shopping or when you're not able to physically distance yourself from others. Thank you to all the employees who are doing so much to keep our workplace safe and the residents safe. This past week was Nursing Week, an opportunity to recognize the key role our registered nurses and licensed practical nurses perform. Nursing in long-term care is a calling. Those who answer the call must be leaders, practitioners, advocates, communicators, hospice providers, mentors, and so much more. We're lucky to have such a dedicated and hardworking team and are thankful for their expertise, their commitment to their profession, and to the residents of St. Vincent's. Thank you very much. Please enjoy a safe and physically distant long weekend, whether you're on duty or at home.